Good afternoon, everyone, and welcome to Community Chats. Once again, here with you is Sandra Arevalo. I'm the Director of Community Health and Wellness at Montefiore Nyack Hospital. Today is June 12th, 2025, and with us is John Bunipero. And John and I have been somehow partnering to be able to create a little bit more awareness about the importance of sleep. So, John, I'm very happy that you're here. John has been having some tables here at the hospital talking to people about sleep, but now it's also time, to bring this information to the community. So he's going to be talking to us about obstructive sleep apnea, and I think that it has something to also with snoring and all of that, which might be common to some or many of you out there. So John, thank you so much for being here.
Thank you, Sandra. Yeah, so today we're going to talk about what you need to know about sleep apnea. My name is John Guinapre. I'm the clinical education specialist for Persante, and we help manage the sleep lab at Nyack. So we're partnered together, and we do have a sleep lab at the hospital. So as we get into this, please keep that in mind. But yeah, we'll get right into it. So a couple of things with regards to sleep apnea. This first slide just kind of articulates a little bit of how it's in our everyday life. So unfortunately, some cases, famous actress Carrie Fisher passed away from sleep apnea, and some other factors. Major accidents such as the New Jersey Transit engineer in a fatal Hoboken crash. You may have seen some of these headlines. Obviously, the Tracy Morgan crash from a few years back. A lot of these have correspondence with sleep apnea. So it's in our everyday lives as far as affecting others who aren't even affected by the actual disease state as well. So, Sandra mentioned snoring. That's one component of it, but we're going to get into it today a little bit. We'll talk about, sleep apnea in general, types of sleep apnea, tests, different types of tests, treatment, and things of that nature. At the end, if there's questions, I'm happy to answer them, but certainly you can direct your questions to me or Sandra at any point in time moving forward. So what is sleep apnea? It's a serious sleep disorder. It occurs when basically an obstruction happens within the airway. So the patient is not able to breathe normally. Untreated sleep apnea really causes a stop breathing during the course of the night. So if you think about that and you think about how it corresponds with oxygen getting to your heart, other organs of your body, there could be lots of different types of outcomes that are unfavorable. So like it says here at the bottom, this means the brain and the rest of the body not getting enough oxygen. So two different types of sleep apnea. Obstructive sleep apnea, which commonly you'll hear snoring and things of that nature. That's that occlusion that happens within the airway. Lots of times it's a fatty tissue that causes that obstruction and literally blocks the airway from being able to get oxygen and air through it. The other one is central sleep apnea, which is more brainwave related. Basically, the signals that take place in your brain to breathe at certain points during the time, you're not getting that. So there's different diagnosis treatments that take place, and then treatment in general as that has been diagnosed that the patient will undergo. Interesting statistic here. I mentioned this to Sandra before the call started here. Around 40 million patients people are affected by sleep apnea. It's 1 in 5 American adults has at least mild obstructive sleep apnea. About a third of those folks are moderate to severe. So this is affecting many people. I do have many types of clinical education tabletops and information sessions. Many people witness either within themselves or their bed partner snoring and other things like that. That's usually the first telltale sign that something's going on. So it's very prevalent. Risk factors and medical implications. So this is when we get into some comorbidity type of comortality type of stuff. Here's some risk factors here. Being male, that's a major factor. Overweight, being over the age of 40, neck sizes. So the larger the neck, the greater the chance that there's actually obstructive sleep apnea. 17 inches or greater in men, 16 inches or greater in women. large tonsils, large tongue, small jawbone. So there's some uh, hereditary things that could play a part in this as well. But certainly some anatomical things within your body that kind of contribute to risk factors. Family history of sleep apnea. Reflux is another one that pops up here. Nasal obstruction due to deviated septum, allergies, or sinus problems. So a lot of different risk factors for obstructive sleep apnea that are common here. Talking about the obesity piece. So the heavier you are, the higher the chances of obstructive sleep apnea. And it also makes it harder to slim down. So you're not as energetic. You may live more of a sedentary type of lifestyle. So it kind of compounds on top of each other. When you're overweight, you have fatty deposits that kind of collect in your neck, and they block that breathing that I talked about earlier, where the obstruction takes place in that airway and you're not getting oxygen. Good news is once you're treated for obstructive sleep apnea, the more energy you have, the more likely you are to get out there, exercise, and then by and large, you could reverse parts of the piece here as well. Diabetes is another big factor that is prevalent in obstructive sleep apnea. So 7 in 10 people with type 2 diabetes have obstructive sleep apnea. So that's a pretty large percentage, 70%. The severity directly impacts diabetic symptoms. The more severe diabetics untreated obstructive sleep apnea, the poorer that glucose control. So by having untreated obstructive sleep apnea, your diabetes gets worse. Treating obstructive sleep apnea in diabetics improves nighttime glucose levels and insulin sensitivity. So obstructive sleep apnea plays a big part in the well-being of diabetic patients. And diabetic patients with diabetes really should be screened. Cardiovascular events, high blood pressure, folks that have known hypertension, that's a risk factor. You should be screened for obstructive sleep apnea if you have high blood pressure. Between 30 and 40% of adults with high blood pressure will have sleep apnea. 80% of patients that do not respond to hypertensive medications have sleep apnea. So if you have high blood pressure, you're taking blood pressure medication, it's not as controlled as the physician would like, you're very likely to have sleep apnea in that case as well. So just, high blood pressure, and even if you're getting therapy or getting treatment for high blood pressure in the form of a medication, you still should be screened. Seeking and adhering to sleep apnea treatment, it's a means of decreasing blood pressure overall. So everything kind of plays a part here. You treat obstructive sleep apnea, you improve your blood pressure situation. Evidence shows that obstructive sleep apnea treatment lowers nighttime and daytime blood pressure, with the greatest improvement in patients seeking treatment for moderate to severe sleep apnea. And just as a side note, that moderate to severe sleep apnea patient population, you're talking about a large portion of the night where you actually are stopped breathing. And as you got deeper into the nuances of sleep testing, AHI is a measurement, and anything really over 15, you're into that mild piece. You can get up to 50 or so. So it gets very high. And in some cases, periodically throughout the night, you could be talking about an hour worth of not breathing during the course of the night when you put it all together. So pretty significant stuff, with some implications that, you definitely need to go out and get screened, get tested, and ultimately get therapy. Stroke occurs. Stroke is another implication of obstructive sleep apnea. Sleep apnea can be an after effect of stroke. So if you had a stroke, you certainly want to make sure you're monitoring for obstructive sleep apnea. Sleep apnea causes low oxygen levels and high blood pressure, both of which can increase the risk of a future stroke. So again, that by treating obstructive sleep apnea, you're going to improve some of the other disease states that you may have. AFib patients, estimated that nearly 50% of patients with atrial fibrillation have sleep apnea. Sleep apnea can cause drops in blood levels of oxygen and abnormalities in balance with the parasympathetic and sympathetic nervous system, the fight or flight response. So all these stresses can cause problems with the electrical firing within the heart that can lead to atrial fibrillation. So it's stress on the heart. And again, as a result of that, if you're familiar with atrial fibrillation, all these things kind of go hand in hand, and obstructive sleep apnea contributes to that. Again, 50% of patients with atrial fibrillation will have sleep apnea. So again, we talked about diabetes, we talked about cardiovascular patients with high BMIs, things of that nature should all be screened. So the effects of obstructive sleep apnea, you could just imagine off the top, lack of sleep, you become irritable, all that sort of stuff. But a couple of key points here: untreated and ineffectively treated sleep apnea, obstructive sleep apnea, has adverse effects on individual performance as well as safety. There's a clear relationship between excessive sleepiness and work productivity. Screening for OSA in the workplace has the potential to identify low productivity and be able to reverse that at some point. Cognitive impairment. Sleep problems can alter mood, making people with sleep apnea jumpy or quick-tempered, making it more difficult for them to navigate the challenges of everyday life. So many problems associated with sleep apnea are interconnected, as you heard earlier. But in the cognitive impairment piece, if you don't treat obstructive sleep apnea, some of these things will pop up as well. Immunity. Basically, what this slide is stating, lack of sleep, lack of oxygen to your organs and other areas of your body could cause you to be immunocompromised, could cause you be maybe more susceptible to infections, colds, things of that nature. So again, making sure that you're sleeping well, getting oxygen to the rest of your body is very important to stay healthy. Mental health. A study by the Center for Disease Control and Prevention found people with sleep apnea were more likely to experience depression. Okay, obstructive sleep apnea is likely to interfere with mental health because of reduced oxygen supply. This all could contribute to developing depression. So lots of the things I do on a daily basis, a big part of my job is reaching out to the outpatient offices, primary care docs, internal medicine, pulmonary, you name it, cardiologists, and talking about the importance of screening for obstructive sleep apnea on as many patients as you possibly can. So this brings us to our sleep assessments slide. The first thing that we typically use, or I use in most cases, is what we call a stop bang questionnaire. And as you can see it here, the parameters in which it's evaluating is, number one, snoring. Do you snore? Tired. Do you feel tired or fatigued during the day? Observed. A bed partner or someone may observe that when you're sleeping, maybe there's intermittent breathing taking place during the course of the night, or choking or gasping phenomena that's taking place. Pressure. Do you have high blood pressure? Do you have high BMI? Are you older than the age of 50? Again, the neck size, we talked about the neck size earlier. And again, are you male or female? If you're male, you're more likely to have obstructive sleep apnea. Usually 3 or more of these, you definitely want to get screened for sleep apnea. And these are available too. Make sure you guys have my email, or certainly can reach out to Sandra. If we need to get some of these out to some of the participants today, I'm happy to do so, some of the questionnaires. Another one that's actually commonly used by providers is the Epworth Sleepiness Scales, which gives you a rating, 0 through 3. 0 being would never doze off, 3 being there's a high chance of dozing off. And it just talks about daily activities such as sitting and reading, watching TV. Are you a passenger in a car without a break, lying down to rest in the afternoon when circumstances permit, sitting and talking to someone? You can see all the different parameters here, but it's another scale that's used to kind of evaluate the level of potential sleep apnea. And again, the stop bang Epworth Sleepiness Scale, we use these to see if a patient really should be going for a test for sleep apnea. This brings us to diagnostic testing and treatment. So we talked about, some of the screening things that a provider may be able to talk to a patient about. And let's say they send a patient off or they want to have a test for the patient. So there's 2 types that you can have: an attended sleep study or a home sleep study. This provides the data to see what if the patient has obstructive sleep apnea and what level. So again, these are the two types of tests. So in the attended sleep test, this is a much more involved study in lab. So the patient would go off to a hospital or a dedicated testing site. This attended sleep study is also known as a polysomnogram, commonly also PSG. So it records your brain waves, heartbeats, and breathing as you sleep. This data, as I mentioned, will help your doctor make a diagnosis and develop a treatment plan. An in-lab study involves overnight stay, as I mentioned, at a sleep center, hospital, or sometimes they may utilize a hotel room in some cases. NIAC has a sleep lab right on its premises, so you'd go right there. And these environments are set up to make you as comfortable as possible so you can have a full night's sleep. And the NIAC sleep lab is a very nice sleep lab, very comfortable. Home sleep tests, it's exactly kind of how it sounds. So home sleep test, it's used to diagnose obstructive sleep apnea. There's a variety of different testing devices out there. It measures breathing and blood oxygen level and allows the patient to stay in the comfort of their home. And then once that test is completed, based on the device, the information is collected, the results are evaluated, and then you can determine what type of treatment plan you want to have at that point. And we have a drop ship program that we implement that we would send this directly to your patient's home as well. So we've uncovered the screening piece as far as, does the patient need to go and have a sleep test done? We've uncovered the diagnostic opportunities, be it in lab or the home sleep test. Now we're at a point that we've determined that the patient has obstructive sleep apnea, and we're going to have treatment at this point. So number one, just kind of like everything out there, diet, exercise, any type of lifestyle change that will help in an effort to lose weight is number one initiated. The other piece and the gold standard of treating obstructive sleep apnea is CPAP, which stands for continuous positive airway pressure, or similar machines that are out there that kind of use the same type of technology, sometimes a little bit more robust setting capabilities. There's oral breathing devices, nasal dilators. There's medicine now to help stay awake during the day, surgery, things of that nature. So there's multiple ways to treat obstructive sleep apnea. The gold standard is CPAP. So I kind of ran through a ton of different things here to kind of give you a little bit of an idea as far as what sleep apnea is, why you need to be screened, if the BMI is high, if you're diabetic, cardiovascular issues, and then just general, if you're experiencing sleepiness, bed partners experiencing that you stop breathing during the course of the night. These are all things that you really want to consider, and make sure you bring up to your primary care doctor. You may want to share that you sat in on this presentation today and you had some concerns and you wanted to at least be screened for sleep apnea. It'd be a good move to have that discussion with your primary care or your doctor in general. Sandra, that's my presentation. I don't know if there's questions or what the case may be.
Yes, thank you, John, for your presentation. It was very nice and very informative. So now we are going to ask attendees, if you have any questions, you can write them in the chat or the Q&A, and I'll be happy to read those questions to John. John, let's talk a little bit about the services that you provide here, about how many patients or what's your capability to be doing the sleep studies here at NIAC.
Yeah, so we have multiple beds in lab to take on basically patients, any type of patient. We have adult patient population. So at the end of the day, like I said, we have in-lab capabilities. We have the home sleep testing capabilities where we can send the devices out to patients. So we are at a point where we move patients along very quickly through the process. Things do depend upon insurance carriers and availability of the patients, but we're full up and running and have robust services that we can take care of the patients at a moment's notice.
Mm-hmm. Can you walk us a little bit through the process? Like, do you first to get diagnosed and then to get treated? Like, where do you start? If I think that I might have obstructive sleep apnea, where do I start? Go to the primary care or a specialist?
Absolutely. Yeah. Yeah. So, you're going to know best. So hopefully if, some of the folks on the call here today, they recognize, oh, I'm snoring, or I mean, I am tired during the course of the day, or I'm a male, or I have I'm a little overweight, whatever the case may be. Some of those screening tools are really the kind of the first piece, even if they're not filling out that questionnaire, but just in their mind, some of those things peek their head. They know they have a large neck size, whatever the case. Bring it up to your primary care doctor. That's the first step. Okay. So when you go and you speak to your primary care doctor, you talk about some of the symptoms that you feel maybe they're associated with obstructive sleep apnea. The doctor at that point will do one of two things, really kind of understand, yeah, you know what, you do need to have a test done, and they'll write directly an order for a sleep test, or they may write for a consult where they would send an order to our medical director, and then our medical director's office would set up a time to meet with that patient and do a full diagnosis and evaluation of the patient, and confirming, yes, they do need to go for a test, or they don't.
Mhm.
I think starting with just understanding those symptoms and then make sure you have a discussion with your provider.
Okay. And we have a question here. Do insurance companies prefer home sleep tests?
So, great question. Yeah, a lot of things in the medical world do depend upon what insurance carriers will cover. By and large, home sleep tests are covered a little bit. It depends on the severity of your, what you think obstructive sleep apnea would be. So, if you check off a lot of parameters as far as the screening piece, and there's really good justification for an in-lab, it should be covered. A lot of times, most HSTs will be covered in general. So, to answer your question, HSTs are covered more, but in labs, if justified, 9 out of 10 times will be covered.
Okay, that's now, can you walk us through what the test looks like?
Yeah, so I'll kind of do this without an actual picture, but so for an actual PSG, you're going to have multiple leads. You'll have an EEG lead. You'll have leads being things that are connected to you, right? You'll have a pulse oximeter to your finger. You'll have leads on your head, leads on your chest to monitor your heart rate. You'll have an effort belt to understand, when you're breathing in and the type of effort that's taking place on that part. So those are all the in-lab study, the PSG. You're going to have a lot more leads, connectors to your body that will really evaluate you in a much more comprehensive way. In a home sleep testing center, we have devices that we use that really have one lead that goes to your chest and a finger probe, and basically we kind of just and a like a watch related thing, so it sits on your wrist. So very simple. The HST, the home sleep test models, are much more simpler, but they're not evaluating as much. But they do have the capability to diagnose mild to moderate people. But in general, your connections on the home sleep test are going to be a lot less than they would in the in-lab PSG. Hopefully that answers what you're looking for.
Yeah, and John, there is something that I've always wondered. Is like if you're attached to this many wires in your body, and you know that your sleep is being tested, and especially if you have to go to like a sleep center or something like that, how are you going to have a good night of sleep? You know what I mean? It's like I always wonder that. It's like, okay, if I go
Yeah.
there and I know I'm being tested and I have all these wires attached to me, and I like to sleep on the side, for example, like I'm so conscious of everything that is happening, but is it really realistic,
So in most cases, yeah. So everything's going to be relative to really what we feel the disease state's level is going to be, right? So there's certainly what you're talking about exists as far as an in-lab PSG piece where you're going to be conscious of you're being monitored, right? You're in a different type of setting. I will say part of that, what helps is a very comfortable room setting, which NIAC has. And then just in general, you do have the sleep techs are very good at kind of calming people down, making them feel comfortable in the setting that they're in. And then ultimately what's going to happen during the course of the night, you're going to have, most of the time you'll have a reading, right? You'll have something that you can work off. And in many cases, they may determine that you have sleep apnea, and whatever certain level of sleep apnea that they may even interrupt the study to start a titration study. Okay. So you'd be surprised that in that setting, okay, in the PSG, we're sending the right people in for the PSGs, the in-lab stuff, that in a lot of cases we are able to determine that they have sleep apnea. When in some cases we stop that test because we know that they have obstructive sleep apnea, and we'll start a therapy type of test so that when they leave, we know what type of settings they need to have on a CPAP machine. In the home sleep test setting, you're sleeping at your home, so it is, they're very, you can sleep very, very calmly and easily. You do have an understanding that you're being tested. But again, if you really have the disease state, obstructive sleep apnea, and the test is in the lab or at your home, you're going to fall asleep at some point, or if you're not according to testing standards, and we're going to be able to diagnose. So it's tried and true methods either way, and we're able to get the data we need.
Mm-hmm. Okay, so it doesn't need to be like 8 hours of data, or like 6 to 8 hours. Just a little chunk of data will help.
There needs to be a chunk of data. Yeah, there needs to be a chunk of data that they can evaluate and be able to say, yes, there's obstructive sleep apnea happening. Because what's happening in the period of time that you are sleeping is they're detecting obstructions in your airway. So there'll be graphs that show breathing, and then maybe a flat line, and then something. So not a flat line, not according to heart rate, but breathing. Yeah. So, and that's, yeah, no. But it does detect the breathing pattern, and if the breathing pattern's interrupted, we can detect and create what we call AHI, an apnea hypopnea index. So apnea is a large period of time you're not sleeping. A hypopnea is a small period of time. So they collect that together and they develop an AHI, apnea hypopnea index, and I believe it's around 5 or greater. We're going to have probably some treatment taking place at that point, or 15 or greater. We're trying to get it down to 5 to be healthy. But there's parameters in there that they're looking at, and we just need, as you said it well, Sandra, it's a chunk of time to evaluate the AHI.
Yeah. Oh, that's really good. Well, I don't see any more questions here, John. Is there any last thoughts or comments that you would like to make?
Yeah, no, I really appreciate being on here. This was fun. The thing is, there's resources, as I'm looking at on my screen right here, that you can get more education on. Anytime I hear I talk about sleep apnea, somewhere, oh yeah, it's snoring, it's so annoying, it's this, that. It's more than just annoying, right? There's a lot of underlying disease state issues. There are things that can impede your health. Please go get screened, talk to your providers. I'm happy to provide those questionnaires if you'd like. But thank you, Sandra. I appreciate it.
Of course. And I just got a comment here. Can I get a copy of the notes? I joined late. Not only can you get a copy, but even better, we're going to be sending the link to the recording to all of you so that you can see this whole presentation in your own time, and then maybe share it with someone that you find that needs the information. So thank you, John. And I really hope that more people start paying attention to this. I know it happens probably when we're sleeping, literally, right? Pun intended.
Absolutely.
But nonetheless, it's very important that we pay attention, because as we saw in this presentation, it can lead to many complications. And those complications can make sleep apnea even worse. So, okay, let's keep dreaming, I guess, of a better world and better health. And I will see you soon. Next week, we're going to be talking about hospice services, what they really mean. So I'll see you on Thursday at 12 o'clock. And thank you for being with us today. Have a good day. Bye-bye.
Thank you.